Hello everyone, good afternoon again. This is Dr. Das from Freeport Medical Center. We are continuing our educational drive to all our patients, all our followers, all our friends, everyone who is looking on Facebook. I'd like to say welcome again to our live feed, and today we are discussing a very important topic of kidney disease. As you all are aware, the kidney is one of your most vital organs in your body, and it has a number of functions attributed to it. And today we are going to be discussing one of two parts. I'm going to be dividing this discussion into two parts. One would be directed towards the structure and function of the kidney, and I'll touch on one of the acute problems that is very common, urinary tract infections. And next week, Monday, we will be discussing chronic kidney diseases. So the diseases of the kidneys can be divided into acute diseases and chronic diseases. So today I will discuss one of the acute disease, which would be urinary tract infections. In fact, that's one of the most common problems that affect the kidney. I like to see, I'm seeing Sudai. Hello Sudai, and China. Good afternoon to both of you. Rita is also logged on. Emma is also there. Hello everyone. Welcome, and I hope that you all enjoy our live video today. Now, to tell you a little bit about the kidney is located in the what we refer to as the retroperitoneal space in the abdomen. Now, retroperitoneal means that it is not within the abdominal covering. So it's in the abdominal cavity, but in the abdominal covering there is something called a peritoneum. It is a thick fascia, a thick layer of fascial tissue that holds all the organs on the abdomen together. And the kidney is one of those organs that is situated behind the fascial layers, and it is located between the peritoneum and also the what we call the posterior abdominal walls. All right, it's relocated in an area known as the retroperitoneal space, and sometimes or most times people refer to it as in the loins. So the kidney is located in the loins, and hence when you have a problem with the kidney, you will feel pain in your loin area. All right, so that's the first thing. So this location is a little bit it's important, and it's a little bit unusual. It's not within the abdominal peritoneal cavity. Now, the kidney is what we refer to as a bean-shaped organ. If you picture a red bean, you would have a great idea of how the kidney looks like. It's a bean-shaped organ, and its structure is made up of a highly dense tissue and an open area. It's something like a funnel, where the big area of the funnel is where the tissues are, and then urine drains down into the tube known as the ureter, and that urine now passes into the bladder for excretion out of the body. So the tissue area of the kidney is where the function of the kidney takes place, and that area in terms of anatomy is made up of heavily dense tissues. The units that are used for filtering the blood and creating urine, which are known as the nephrons, and those nephrons now release the urine into the pelvis of the kidney, which is that open collecting area, and then the urine drains down into the ureter. All right. Now the kidney is approximately 11 centimeters in length and about 6 centimeters in width. It can vary between 1 to 2 centimeters in different people. As you know, everybody are not the same, so therefore you can have a little bit smaller, a little bit bigger, right? I'm seeing some new people logging in. Hello Camille. Gaylan is also logging in. Riri is also logging. Yes, very well. I got it right this time, Riri, because I've been calling you wrongly the last time. All right. The structure, as I said, is between 11 centimeters in length and 6 centimeters in width, and it's a little bit lower on the right side. So if you think of your body, the kidney on the left is a little bit higher and the kidney on the right is a little bit lower. It is located in the loin, so if you were to use your abdomen, it's just at the level of the ribs, but in medicine we would say it starts at the level of the 12th thoracic vertebrae and goes down to the 3rd lumbar vertebrae. And it's lower on the left because the liver pushes, low on the right side because the liver on the right pushes down the kidney on the right side a little bit lower. So hence the reason sometimes the pain sometimes on the right can be confused with pain coming from the appendix, because the appendix, again, as you know, is located on the right side. Okay, so that's with regards to the structure of the kidney. Now, urine is produced, the blood comes through the kidney from the aorta, goes into the kidney, the blood is filtered into the kidney, and as the blood is filtered into the kidney, urine is produced. This is collected in the ureter, it flows down into the bladder. The bladder stores the urine until you're full. You get that urge. Once the bladder is full, the nervous system then sends a signal to you telling you, listen, you have to go and empty your bladder, and then you will go and urinate. So it's a simple process of making urine, collecting and passing urine, right? I'm seeing some new people logging in again here. Nati, Karian and Annie. Hello everyone. All right, and please feel free to send your questions. Although I am discussing the structure and function of the kidney today, I will take questions on any problem at all that you have on the kidney. It's not a problem. I will be able to answer it one time while we are live. Okay, I'm seeing a question from Ariana Sampat. Good afternoon, Dr. Das. Can you tell me what causes kidney disease? Okay, very good. Now remember that as I mentioned before, kidney disease can be divided into acute problems and chronic problems. The common kidney problems that we have, and a lot of people would think of, would be kidney failure. So that kidneys stop functioning, it fails, meaning that it's not working, it's not producing urine, it's not doing what it's supposed to do, and then you have to go on dialysis. That's the common thing that people think of when they think of kidney disease. So if that is what you're referring to, then the most common causes of kidney failure would include chronic illnesses like high blood pressure, uncontrolled diabetes, stone in your kidney or bladder that has not been treated. Chronic infections like lupus and different things can cause kidney failure. Even chronic infections can also cause kidney failure as well too. Alright, hope that answers your question. Emma Ramnath is asking, what are the symptoms of kidney disease? Very good question. Emma, I'd like you to hold that question there. I'm going to answer it just now, because to answer that question I will be telling you about I'm going to tell you about the function of the kidney now. Now the kidney, most times we think of the kidney as filtering the blood and producing urine. So that's the main function of the kidney, is to filter the blood and get rid of the waste from your blood. That waste is mostly nitrogen products from the digestion of food, mostly protein. So you produce urea, you produce nitrogen products, and this is excreted in the urine. So it's the first function is to produce, to filter the blood and get rid of the waste from your blood. Okay, it also is involved in maintaining homeostasis of your electrolytes and the water balance. In other words, your body is made up, as we know, as we mentioned before, 70% of water, and this water, the maintenance of the balance of water is done by the kidney. In other words, if you have too much water in your system, if you drink more than 4 liters of water today, it's most likely you're going to produce 3 liters of or 2 liters of urine. Or if you just drink 1 liter of water today, there's a chance that you will hardly produce urine today, because your body ideally requires 2 liters of fluid every day based on a 70 kilogram person. So a normal sized person would require 2 liters of fluid every day. So it maintains that water balance, it maintains the electrolyte balance, and our body needs sodium, potassium, chloride, phosphate, magnesium, calcium to function properly. And these electrolytes, the balance of these electrolytes are done by your kidney. So that's the second function. The third function, which a lot of you all would know, would be to help in assisting to produce blood cells, which is known as hemoglobin by the bone marrow. So the kidney produces a hormone known as erythropoietin. Erythropoietin is produced in the kidney, it goes to the bone marrow, stimulates the bone marrow to start producing more red blood cells. That's a third function. A fourth and very, very important function I don't want to miss this function. Riri is asking, do I have to change what I drink if I have kidney disease? Definitely, yes, you have to do that. I will answer that just now. Tina is asking, is dialysis a cure for kidney failure? Very good question. I'll answer that right away. Dialysis is a means of filtering the blood. Dialysis only does one of the functions of the kidney, which is to filter the blood and takes the waste out of the blood. It doesn't do anything for the erythropoietin. It doesn't do anything else other than filtration. Of course, it's a very important function, because your kidney, if it's not functioning, the waste builds up in your blood, and of course, once it goes to your brain, it becomes toxic, and a patient can die very easily from kidney failure. So yes, dialysis is a means of treating the patient or managing a patient, but it's not a cure for kidney failure. In fact, there is no cure for kidney failure. Once you have kidney failure, there is no cure. Your kidney has failed, it cannot come back. With new technology, a person might be able to have a kidney transplant, and that might in itself cure the problem. But other than kidney transplant, there is no other cure. Ariana Sampat is asking, what measures can I take to keep my kidney healthy? Very good question. What kind of diet is recommended for a person on dialysis? So I see a lot of people asking dialysis. I will say that the questions on dialysis will be answered in our next session, which will be next week, Monday. Annie is asking, what to know if overactive thyroid and underactive thyroid affects the kidney? If they do, what's the difference? All right. Generally speaking, the thyroid gland is not going to affect the function of the kidney very much. It may slow down or speed up the blood flow to the kidney, but in terms of its intrinsic function, it will not affect the kidney itself. All right. A very, very good question. Michelle here is asking, hello Michelle, she's asking, if there is pain while urinating, does that mean I have a kidney disease? That is very, 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 very good question. Pain while urinating definitely points towards your urinary system. The problem could be either in your bladder or in your kidney. Pain while urinating must be investigated. As I mentioned before, kidney stone, kidney infection, if not treated, can cause you to develop kidney failure, and you don't want to develop kidney failure. Pain while urinating points to either one of those, and it could be more problems, but those are the first ones that we will look for. Of course, kidney stones and kidney or bladder stones and kidney or bladder infections, definitely. Alright, so I mentioned filtering the blood. I mentioned maintaining homeostasis, producing erythropoietin. The fourth function would be producing renin. Renin is another hormone, and we refer to renin as a system, renin, angiotensin, aldosterone system, in which renin is a hormone which converts, helps to produce aldosterone, which is important in regulating the sodium and potassium balance in your body and the blood pressures. So in the end effect, renin is important in regulating your blood pressure. So definitely renin is an important function in the kidney in maintaining pressure, and a lot of people probably would not have known that. Very important. What can you do if you have acid reflux? Well, acid reflux is really not related to our topic today, so we would not really focus too much on that today. I see Sita Rajkumar is asking, thanks doc for all this beautiful advice. God bless you. Continue the good job. First time in Trinidad, I see a doctor who is going live on health. Keep up the good work. Thank you very much, Sita. And also, the kidney is also involved in absorbing and involved in calcium metabolism. So it involves in converting vitamin D, which we get from sunlight, and that vitamin D now is converted in calcitriol, and that now is used in the conversion of is used for calcium to be metabolized and used by the bone marrow for production of bone. So you see how it's important when patients who doesn't have a functioning kidney can develop osteoporosis very, very fast, and sometimes we even have to put them on calcium supplements because they are unable to absorb calcium from our intestine and then send it to the bone marrow for proper functioning. Alright, Nati Maraj is asking, don't forget to let me know. Hey doc, okay. Alright, so those are the functions of the kidney. So you mentioned in the metabolism of calcium, if I go in the reverse order, renin, angiotensin, aldosterone system, erythropoietin, maintenance of hemostasis, and filtration of the blood and removal of waste from your blood. Okay, so therefore, if a person's kidney is not working, then it's now easy to see some of the functions, some of the problems symptoms that you can present with. The first symptoms, if a patient has kidneys not working, you're unable to filter urine, you're not able to produce urine, unable to filter the blood, so therefore fluid start building up in your blood, and patients start developing edema. So if you see someone, start swelling suddenly, legs start swelling, face starts swelling, belly starts swelling, abdomen, everywhere, entire body starts swelling, then that points towards either your kidney is not functioning, your heart, your liver. You need to go to a doctor right away. The other things like your blood count will drop, you'll develop osteoporosis very fast, your blood pressure will go up, you will get tired, you look pale. Those are the symptoms of kidney failure. But more specific today, I want to dive straight into one of the acute problems that affects patients very often, and it has been said in medicine that 1 out of 2 women will develop a urinary tract infection. It is because women are more susceptible or more easily develops urinary tract infections, and it's one of the most common problems that we see as doctors in our practice. And I would like to say that if a person, now it's not uncommon to have it in men as well, especially as men get older and they develop prostate enlargement, or they develop prostate problems, or even if some of the male patients has immunocompromised status like diabetes, HIV, etc., you develop infections as well. But the most common, more commonly, it will affect women. And if a person has a urinary tract infection, they would complain of going to the bathroom often. So if you are not, and how most times we would pick this up by asking, do you go to the bathroom at night? And they would say, no doctor, I don't go to the bathroom at night, but since last week I've been getting up twice. So once a patient is not accustomed to going to the bathroom in the night time and suddenly start getting up to pass urine at night, you know that there is something happening and you need to see a doctor immediately. Another symptoms of urinary tract infection that patients complain about would be burning when the urine is coming out. So patients have burning while urination. They may be going often to pass urine, and sometimes you may have pain over your pelvis, and sometimes you may also have fever, and sometimes you may have chills. Of course, the other symptoms like tiredness and so on may also come in as well. Alright, I'm seeing another Savannah, God's gift angel. Thanks for the valuable information. My question is there a mixture that can be used to flush the kidney? Haven't come across this on the internet. Are these healthy? Okay. And Riri is asking, what healthcare professional can I see for kidney failure? For kidney failure, generally speaking, you have to see a nephrologist. That's the doctor who specializes in kidney problems. But as I said, if you develop kidney failure, you ultimately have to have kidney dialysis. All right, and otherwise, without dialysis, you're going to expire. All right. Yes. So kidney failure is something you have to get treatment. The good thing about kidney failure and dialysis is that dialysis is available at Freeport Medical Center. So patients who have problems and they need to get dialysis, they can always call our center here to make an appointment for dialysis. In terms of something to drink for kidney problems, there are lots of medication that we use, for example, supplements for calcium, supplements for renin, supplements for erythropoietin. Of course, there are lots of supplements that can be used if you develop kidney failure, definitely. All right. Vikash Sahadev. He's not a question. Sita is asking again. If you get up to 5 minutes, I drink a lot of water. I would. If you drink a lot of water, it is okay to get up. Yes, if you drink a lot of water, Sita is asking, is it okay if you get up at night if you drink a lot of water? Yes, that would be okay. If, however, you're getting up at night, but you also have burning or you have pain while urinating, then definitely you have to get it checked out. Okay. Another symptom that I don't want to leave out is that the urine itself changes color. So sometimes if you're observant enough, you can see sometimes the urine gets darker or it gets cloudy. Those are signs that the urine is infected, so the color of the urine looks different. Alright. Once that happens, then you have to get a urine test, and that is done by the doctor. He does a urine test. And nowadays we have to be so careful. I like to recommend an ultrasound, because sometimes if the urinary tract infection travels up the bladder into the kidneys, it can cause damage to the kidneys. So I would like to check your kidney to make sure that it has not been affected by the infection, and therefore we do a ultrasound of your kidney. If we are suspecting that it could be a situation that is arising from a kidney stone or a bladder stone, we'll then also have to do an X-ray or a CT scan as well too. Alright, and once this problem has been diagnosed, we then put the patient on antibiotics to treat the problem. Okay. There are some advice that women particularly have to get with regards to infections. These I would not give today, but you need to ask your doctor about some of the things that women should do in particular to prevent infections, and they should get the advice of their doctor to ensure that they don't get infections too often. All right. Women in particular who are more prone to developing urinary tract infections. All right, so I'm going to wrap up now. Just to remind you that today I've been speaking about the kidney. I tried to show you how important the kidney is. It's an organ which we thought a lot of people think is only needed for filtering the blood, but actually the kidney does much more function than that, and it's a very important organ, and it's a lot to talk about. So I had to divide our information into two parts. So today I was restricted the talk to function, anatomy a little bit, and also the urinary tract infections. Next week I'll talk about the chronic problems, and the one that most people really want to know about, which would be kidney failure, and I will discuss that next week, and other forms of chronic kidney problems. I like to remind everyone that we are available 24 hours. We are here on Facebook available. You can ask anytime you can ask your questions, and we will be able to respond to you. Feel free to post your questions, and you will get a response, right? All the tests that were mentioned are available at Freeport Medical Center, including x-rays, ultrasound of the kidney, CAT scanning of the kidney and bladder, and blood tests as well. The urine test is also available here. Alright, I'd like to thank everyone for logging in. Thank all our patients who have been visiting Freeport Medical Center. Sarika, thank you, Emma, Tina, everyone who has asked questions today, and I hope to see you all again next week when we're going to be discussing chronic kidney problems. All right, and just before I leave, remember this week is WHO is celebrating World Health Day. It's on Friday, so we will probably say a little bit about World Health Day on Monday, to celebrate World Health Day, which I believe that they are trying to bring out the awareness of depression, which in fact is a very common problem as well. To a lot of people are not aware of how serious and how common depression is, with the amount of stresses and stress factors that exist in our daily lives every day. All right, thank everyone again, and goodbye. I'll see you all again next week. Bye everyone. See you all.